Thank you, Chantal. We are just at time, so I'm going to ask you to answer your many questions in the chat, please. And next up, I would like to introduce Kevin Libuit, who will be speaking from Theiagen Genomics about the methods that they use to develop bioinformatic pipelines for sequence assembly analysis.
All right. Thank you, Anna. Appreciate it. Thanks, everyone, for giving us this time. Thank you, Anna, for emceeing this and keeping all the presenters in line with our short little time allotted to speak there. So thanks, everyone. My name is Kevin Libuit from Theiagen Genomics, and I think I'm going to be offering just a little bit different perspective because at Theiagen Genomics, we really work alongside the public health laboratories to try to operationalize and integrate a lot of the innovations being talked about on this consortium here. And I'm going to kind of frame my talk with respect to the lessons learned through COVID-19 and how that's impacting our response and actions in the face of something like monkeypox here. So looking at some of the real critical lessons learned, obviously this is by no means a comprehensive list of the things we've learned throughout COVID-19. But with respect to our sort of niche field of public health bioinformatics and adoption of these practices, I think some of the two major lessons we've learned, spoken about again a number of times on this call already, is one, the utility of amplicon sequencing for this distributed public health pathogen genomics, especially with respect to surveillance efforts. That being attributed to, as again seen in the last two talks, of how robust these wet lab protocols can be and how there really is a sort of defined best practice already in mind with respect to amplicon sequencing and consensus genome assembly in terms of mapping it to a reference, removing the primer regions, don't fill in the reference genome into the consensus assembly. But an aspect of this maybe not fully appreciated, especially by the academic community here, is despite having those defined practices, a major challenge in the public health space is actually integrating these into laboratories who have no extant bioinformatics capabilities, no CLI environments, no Linux operating systems, and things like this. So over COVID-19 pandemic, I think one thing we really learned about is putting together a model for rapidly distributing these bioinformatics resources. And this has really come by way of use of open source containerized workflows that are then presented to the bench-side user through a GUI interface and ideally having some kind of cloud-based backend. And again, this is something we've seen kind of come to fruition in a number of different open source cloud-based resources. I think already highlighted here, things like NextStrain, like NextClade, Pangolin even having that interface. Other instances like the Galaxy project, CZ GenEpi, and a number of other folks are really capitalizing on this model of distributing resources to the non-bioinformatics technical practitioners that really need these materials in hand. And so what this has done is really allowed for this practitioner-led R&D, where now the folks who are providing that immediate feedback on software improvement are those who are actually utilizing it to inform their public health decision makings. And one other iteration of this that we found incredibly helpful for addressing a lot of public health needs is the use of a platform called Terra. So this is a platform developed and supported by the Broad Institute of MIT and Harvard that captures this model of open source containerized workflows and scalable compute backend, cloud compute backend. Some of the major features of this is it's an inherent connection to the GA4GH's workflow repository called DocStore. So anyone who has access to Terra is innately connected to thousands, or at least over 1,000 bioinformatics workflows supported by different major institutions across both academic and industry for a whole wide variety of bioinformatics applications. And again, the beauty of this kind of framework on Terra is that it has a user interface that is geared towards the bench scientist who needs to perform the bioinformatics, but may not have the resources or background to maintain a Linux library and the dependencies and install Dockers and things like this. Rather, all that is abstracted away, and in front of them, they have a click button solution to utilize these resources. So again, with conversation of COVID-19, what my team and I have done is, we tried to capture all those best practices for SARS-CoV-2 characterization in terms of, read filtering in QC, read alignment and consensus genome assembly, and then filtering those assemblies into the characterization modules like Pangolin, NextClade, and Vader, and then made that available on DocStore so that we could kind of lower the barrier to access to these bioinformatics resources to public health laboratories that desperately needed this kind of critical technology. And so once we made that available on DocStore, this also coincided with a collaborative effort that we had with the CDC's Office of Advanced Molecular Detection and the Broad Institute, where the CDC supported the use of the Terra platform for all of the U.S. public health laboratories for SARS-CoV-2 research. And so what we saw of this is that, we had a platform and a model for distribution, and then we had federal support to utilize this system. And what that led to was really mass adoption of this platform and immediate access, again, to the best practices that were being defined in our field for how to address SARS-CoV-2 genomic characterization. And not only did these laboratories gain access, they then became part of the conversation and communication of how do we improve this, how do we increase the value add to laboratories that, again, needed these types of information to inform their action. As again, high level from COVID-19, learning the utility in these sequencing protocols, amplicon-based protocols, and then also this method for rapid development and distribution of bioinformatics solutions. So in terms of the monkeypox side of things, I think Chantal really highlighted the project that I'm going to be discussing here as well. Something that was really a collaborative effort that was kind of led by the Massachusetts Public Health, or rather the Massachusetts Department of Health, and then getting both industry and academic partners to collaborate and address a public health problem of concern. And in this case, as Chantal described, they designed this wet lab protocol for monkeypox amplicon sequencing in the same really similar fashion that the SARS-CoV-2 amplicon protocols were developed. And so on our side, our role was, okay, how do we then operationalize the bioinformatics practices so that we can then distribute these resources to public health laboratories that need to do this kind of analysis? And the framework we took is that, looking at the wet lab protocol, because of how similar it is, we assumed that the bioinformatics protocol will also have a high level of similarity in that we're really going to be generating that same consensus assembly or the consensus assembly in a similar fashion. But we just want to bypass anything that's, very SARS-CoV-2 specific. So if you have monkeypox data, for example, you don't need to do a pangolin assessment there and get a lineage designation. And a huge priority for us is ensuring that it didn't impact any modifications we made to TheiaCoV, didn't in any way impact the public health laboratories using this for SARS-CoV-2 analysis. So basically what we did is, we had this basic framework of capturing these best practices, and instead of taking this core module of consensus genome assembly and funneling that into characterization, we simply put a fork in the road. Because we're using these containerized workflow systems, it was relatively easy enough to enforce this logic of, okay, define the organism that you're going to be analyzing, and then providing the option for monkeypox here. So what we were able to do is enable monkeypox genomic characterization for users who already had access to this TheiaCoV workflow. So what it needed on the user was really just, provide the monkeypox reference file, embed file, and a couple other tweaks that are specific to monkeypox, and then you'd be able to get the characterization that is relevant to this specific organism. And one thing I wanted to note, we did work, alongside Chantal and the group that was presented previous to ensure that this was compatible with that short amplicon-based protocol that was addressed there. But, in seeing Matthias's presentation, there's really no reason that you couldn't use the same workflow with reads generated by an alternative amplicon. In fact, this is often what we do with SARS-CoV-2. You just kind of swap out the reference embed files and ensure that you can do the downstream processing from there. So in this framework, we have all these laboratories that have adopted Terra as a system for performing pathogen genomics through COVID-19. And what was really incredible about this is that as soon as we made this same workflow updates available on DocStore, every laboratory that was already using these systems for SARS-CoV-2 analysis now had immediate access to be able to use this for monkeypox characterization. So again, just increasing the feedback loops we had from different laboratories who could tell us, hey, this is useful, I'm seeing something funny here. It just increases the eyeballs on the data and processes that were being distributed. And one thing also to highlight is the kind of turnaround time here, to get all these laboratories on board to Terra and having a robust system for SARS-CoV-2 probably took in the realm of, first 3 months to get the workflow out and ready, and then another 18 months to get as many laboratories as you're seeing here using this system. Whereas our work with Massachusetts Department of Health and Yale and the Broad Institute for monkeypox, the turnaround time was maybe 3 weeks, and the same number of laboratories still had access to to these bioinformatics resources. And so in the open source spirit, and I think, in public health, everything needs to be out there and transparent so we can all get, as I mentioned, our eyes from the other technical practitioners on these resources. All of our source code is made available on GitHub. As I mentioned, the workflow itself is available on DocStore. And we were even able to work with the Broad Institute there to create a featured workspace to ease the adoption, to further ease the adoption of this particular software for public health laboratories. So in a really quick, rapid succession here, I kind of want to show you what that ends up looking like. So folks are aware of, how public health labs are starting to gain a familiarity with using bioinformatics resources. So for laboratories who are interested in checking this out, there is, as I mentioned, a featured workspace. If you go to the app.terra.bio.com, and you'll see that, we populated this with a lot of information about how to use the workflow, the sort of design intent, and then even populated it with some read data generated by the Los Angeles Department of Health, Los Angeles County Department of Health for analysis here. And so you can clone this workflow and see exactly how everything works. But just at a high level, once you have your read data, what this generates is all the characterization components that are specific to monkeypox. And you'll see we have two data sets here, one that has been pre-analyzed, the second of which that is we recommend users to analyze themselves so they get a feel for how to actually use this workflow. And then also on top of that, what's been really nice is that, I can't move my, oh, here it is. You can even dive deeper into, the visualization. So a big conversation is about, what do the ITRs look like with this protocol? Admittedly fuzzy. So there is a lot of incredible information captured throughout, obviously, the non-repetitive regions of this genome. But, you can still visualize and see where are the components where we lack the read support or strong strength in read mapping here. And just finishing up, again, I wanted to reiterate, some of the lessons we've learned throughout COVID-19 is the utility of these amplicon protocols and this model for distributing bioinformatics resources and how we can readily apply this now to other emerging pathogens of concern. And I would also mention that, this model for bioinformatics distribution is not specific to the amplicon analysis there. Obviously, it lends itself well considering how SARS-CoV-2 protocols were developed. But we're also starting to work with a lot of laboratories in terms of whole genome sequencing bioinformatics and capturing those best practices that have been emerging over the past few decades there, and then making sure that we can also present this to the users on the Terra side who really need to use these workflows. So in terms of acknowledgements, there's similar to Chantel, it's really the whole community I want to thank. Some major ones, obviously, the Massachusetts Department of Health, Grubal Laboratory, the Broad Institute, the State Public Health Bioinformatics Working Group, who are containerizing a lot of these software and making that standardized. And then also the various public health laboratories that are using this and providing feedback for us on how to optimize these software. And then one thing I also want to notice or make note of is we're also working with the APHL Global Health to ensure that these same resources that we're developing and distributing domestically are also made available to countries internationally. Because I think another major lesson we learned through COVID-19 is that there is no them, rather the public health community is a collective us. And so we need to make sure as a community we're developing resources that everyone has access to, because otherwise there's going to be blind spots we don't know of. So this is the same model now we're using to distribute these resources at an international scale here. All right, I think I got maybe 30 seconds to just say thank you again, Anna, for corralling this whole thing and keeping us all organized. I can just go ahead and hop into the chat to take questions from there.
Thanks, Kevin. Exactly what I was going to suggest. A really nice talk.
Thank you.